Good morning. My name is Jared. I'm a registered nurse, and I'm going to go through a patient intake for ETN infusion for the infusion of the drug bamlanivimab. The first part of the intake will be receiving the pre-screening evaluation form from Dr. Neum. She'll either send it to you as a text message or preferably as a fax. So when the fax is received, you're going to get a piece of paper that has information on it. Patient's name, mobile phone number, contact information, address, emergency contact, the referring physician. It's also going to have some clinical information, past medical history, and screening criteria for receiving the drug bamlanivimab. So the last part of the pre-screening evaluation is the evaluation by the registered nurse to make sure that the patient is still eligible to receive bamlanivimab. In order to do so, you have to understand what the criteria are for receiving this drug. Criteria for this drug are for patients greater than the age of 12 years of age, a BMI greater than 35, chronic kidney disease, diabetes mellitus, immunosuppressive disease, or patient currently receiving immunosuppressive treatment, patient's age greater than or equal to 65 years of age, patient is age greater than 55 years and has a following condition: cardiovascular disease, hypertension, chronic obstructive pulmonary disease, or other chronic respiratory disease. So in order to make sure that they still qualify for treatment, the patient must be tested and positive for COVID or positive for SARS coronavirus within 10 days of the infusion. The patient also must not require oxygen or increase oxygen support before getting the disease. This drug is not shown to help patients who require high oxygen support. And then I stop there. I can't remember. If there's any question in your nursing judgment that the patient may not qualify for receiving bamlanivimab, if the patient's requiring high oxygen, or if they come in with respiratory distress, aside from calling 911, if the patient is in a medical emergency, call Dr. Neum, call an attending physician to verify whether or not the patient still meets criteria in order to infuse the drug. Mandatory requirements for bamlanivimab administration under emergency use authorization. As a healthcare provider, we must communicate to our patient and parent caregiver as age-appropriate information consistent with the fact sheet for patients, parents, caregivers prior to the patient receiving bamlanivimab. Healthcare providers, to the extent practicable, given the circumstances of the emergency, must document in the patient's medical record that the patient caregiver had been given this fact sheet given for parents, patients, and caregivers, informed of alternatives to receiving authorized bamlanivimab, which there are none, and informed that bamlanivimab is an unapproved drug that is authorized for use under this emergency use authorization. Bamlanivimab, 700 milligram and 20 ml injection. This drug has to be refrigerated because it has no preservatives. Therefore, before injection of the bamlanivimab into an IV bag, you have to let it sit out for about 20 minutes so that it can adjust and acclimate to room temperature. Materials and supplies needed to mix the bamlanivimab infusion are 20 cc syringe, alcohol prep pads, an NS250 bag, 18 or 20 gauge needle, and then the drug itself. The infusion tubing that you're going to be using to infuse the first doses of this drug is a 10 drop per ml infusion tubing. This IV administration set has a 0.2 micron filter, which is recommended to be used for the infusion itself, which is why we're using this set. The rate of the infusion should go at approximately 3 drops every 5 seconds, or about 40 drops per minute. Minimum infusion time is about 60 minutes. Not before, but longer is better. And the approximate setting for doing the infusion is about right there using the roller clamp. But you have to kind of make adjustments as you see necessary, because based on where the IV site is and the possibility of this obstructing a little bit at the site could cause the infusion to run slower or longer. So you're going to have a timer. The most serious adverse event to a bamlanivimab infusion is an allergic reaction. Therefore, the patient needs to be closely monitored for at least the first 5 to 15 minutes from the infusion start. A set of vital signs should be taken, and then the patient should be continuously monitored until the end of the infusion. Another set of vital signs should be taken. Documentation includes the bamlanivimab order, and acute infusion reaction treatment protocol, followed by the infusion center progress note. You'll document your IV access, plan of care, and at the end, discharge status. And the ETN Medical Infusion AIC worksheet, which will include the patient's name, the infusion, vital signs in, and any other miscellaneous charting that you will do. So after the patient has completed the 1 hour monitoring period after the infusion is done, the patient can be discharged. Dr. Niem needs an informed consent for telemedicine services to be signed by the patient. And then the bamlanivimab discharge instructions here will be given to the patients. If the patient received Benadryl because of a moderate reaction, they need to have a responsible person to drive them home.